Hello everyone, this is Dr. Anil Goud, Director of Kosmo Dental Services. Today I am going to talk on the smile designing, like various aspects of smile designing. What actually the smile designing means. So smile designing is a kind of a celebrity kind of a treatment where your dentition is functionally good, but there are certain things which are not according to your face, personality, and that dentition is not complementing to your aesthetics. In those cases, like where your teeth might be having some spaces, teeth might be having some kind of fluorosis or some kind of discoloration is there. In some individuals, there might be some smaller teeth are there as compared to their face. So in that cases, we tend to go with a smile designing. So in this, your normal dentition, functionally they are functioning well. So what we do in smile designing? In smile designing, we'll try to analyze the personality, and according to that personality, there are certain ways of approaching this smile designing. First, one is the conventional approach where a dentist just cut the a bit of a labial portion of the tooth, 0.5 to 1 mm, like laminate preparation, and they will take an impression and then get the lithium disilicate laminates and they bond it over it. So this is a general approach. So they are not understanding the personality, and as per the personality, they are not judging anything. So there is another approach, that is a professional approach, where you need a very expert kind of a dentist who knows about the digital smile designing, who knows about the personalities and all. This kind of an approach where dentists first analyze the personality. What kind of a personality is there? What facial features are there in that personality? What kind of a dentition will suit to them? He will analyze that dentition first, and then accordingly he will go with the smile designing. There are two approaches. One is macro aesthetic approach, then is micro aesthetic approach. In a macro aesthetics, what he sees the shape of the face, form of the face, complexion of the face, and various proportion of the eyes, nose and all, and accordingly he'll come to a conclusion that for this kind of personality, this kind of a dentition will be good in that case. So this is more a professional way of approach over here, and for this very good AI based softwares are there, and this AI based software will help the dentist and the patient to understand what kind of a smile actually they are getting in. This is little time taking, but you will get a proper smile for your personality. Now, how we are going to analyze this personality and how we are going to understand the shape and form of the face, and accordingly we are deciding the dentition over there. So there are certain concepts of microaesthetics. So this concepts like there is a Visajism smile concept, there is a divine smile concept, there is a golden proportional smile concept. So these are all concepts designed certain form of the teeth for certain personalities. So roughly to understand a layman is like, I'll divide this personality into three forms. Like one is a bold and beautiful smile, a second one is a dynamic smile, and third one is a thin and delicate kind of a smile. Now what exactly this means? Now there are certain personalities who are in a very dominant personalities or leadership kind of personality, like an IPS officer is there, or a military officer is there, if a female officer is there. So this kind of leadership roles require a dominant smile. So that is called as bold and beautiful kind of a smile. In this, we try to give more of a prominent teeth, more of a rugged or a kind of a prominent line angle, point angle kind of a teeth, where the dentition is little more prominent in that face. So this is one aspect of a smile designing. And then the second kind of personalities are dynamic personalities. So dynamic personalities are most of the females come into this category, where everything is proportionate in these faces. Like when you see their nose, eyes, ears and all, everything is properly balanced and proportionate, and there is proper balance in between the right and left side also. So these are the personalities which require very rectangle oval kind of a proportionate smile over there. Left side teeth and right side, both are in a proper balanced way. It has been proposed over there. So this is the kind of a smile. When they smile, the smile curvature, the dentition will follows actual curvature of the lower lip. So this is a dynamic personality smile, where we try to give a rectangle oval kind of a shape of the teeth, where the entire dentition following the curvature of the lower lip. So this is the second type of a personality. Third personality is a thin and delicate kind of a personality, where most of the people, the females are a little shy, delicate, and if you see the face also, it's a little delicate kind of face is there. So in those kind of faces, we try to give a thin, transparent kind of a teeth, which will suit to their personalities and all. So these are the roughly we divide those personalities, and then accordingly we design the teeth over there. Now we understood the personality, we try to give some kind of a dentition over there. Then the conflict comes whether you are giving the right dentition or not. How do you diagnose? How do you make the patient to understand this? There we take the help of this smile designing softwares. We have got 2D smile designing softwares, we have got a 3D smile designing softwares, where we take certain pictures and that we upload into this softwares. And this software, they have got the certain algorithms where we show the first the bold and beautiful kind of a smile. We'll show certain dynamic smiles over there, which will morph into that smile, and then we'll show it to them. If they are liking it, then we'll proceed for that kind of a smile designing over there. In Kosmo Dental, we have got a very good team for this smile designing. I myself has got a 20 years of experience in this smile designing. I think I have done thousands of smile designing cases till now. So those who want to have a smile, first you come to analyze yourself. No need to take the treatment. You come to us, we'll take certain photographs, we'll upload into that software, we'll show you that outcome. Then if you are tall, you are comfortable, then you can go for the smile designing over there. That's the best approach for going for smile designing. What all methods and materials are available for this smile designing? The best way to go for a smile design, if at all you are going for a smile design, the best way is to go with the lithium disilicate laminates and veneers. This is the only way of going to transform your smile, because this material is exactly like your enamel. The optical properties of a glass are same with the enamel, are the same with the lithium disilicate. So here the crux over here is the preparation. You need very expert hands to prepare that tooth, so that only 0.5 to 0.7 mm, whichever, how much ever is required, on that much only that dentist should cut, and they then take proper impressions or proper scan of that, and then they will send it to the lab. There they prepare it as a thin contact lens kind of a laminates over there, that we get and bond over your teeth. So here only transformation will be there on the shape and size and color of your teeth, and rest all the teeth, the kind of occlusion, the kind of flavors you are already having, you will be enjoying that kind of a thing. We are not giving the entire crown. If you are giving the entire crown, then the lingual part also is now changed with this lithium disilicate, which is an artificial flavored one. So in this laminates and veneer, we are cutting only on the labial side. So lingual side, your natural tooth is still in that natural enamel only. So you get that proper flavor and that sensation over there. Then the cost. So what is the cost of this treatment? The cost of the treatment is decided upon how much teeth are being involved in the smile designing. Generally, certain faces are there, when they smile, all the teeth are visible over there. In those cases, we have to change the entire teeth, like from the central incisors to the premolar. But there are certain individuals where when they smile wide, only 3 to 3, that till canine to canine only teeth are visible. In those cases, we prepare only 6 teeth. But in the earlier cases, we have to prepare 5 to 5, means that means 10 teeth you have to prepare. So number of teeth will decide the cost of the treatment over here. As this requires a high-end lithium disilicate laminates, so this is bit costly treatment over here. And if you want to go with the a cheaper version in this, you can go with the direct composite laminate treatment, which is way cheaper than the laminates and veneers of the all ceramics. So this can be done in 3,000-4,000 per tooth. That means for a package wise, you can go with a 40,000-50,000, but you are going with the laminate veneers, means it can be somewhere around 70,000-80,000 per tooth. It starts from 4,000 to 12,000, depend where you are going and how which material they are using over here. So this is all about the cost over here. Then comes the side effects. What side effects will be there with this? What precautions can be taken after the laminates and veneers? smile designing treatment. The biggest problem, or most commonly what we face over here in this laminates and veneers, if your dentist is not preparing proper finish lines, and then he's not doing the proper bonding over there, there might be sensitivity for a longer period of time. But in any case, minute sensitivity will be there. There we advise this sensitivity paste for them. You don't need to go for any kind of another treatment over there. Over the counter, whatever the sensitivity paste are there, if you are using it for around 15-20 days, automatically body will take care of that sensitivity. The next is like if your dentist is involved in the full teeth over there, so the natural tooth is compromised over there, if your teeth are root canal treated kind of a thing, in those cases, if you are trying to eat from the front teeth, there might be the problem of chipping of the laminates, or the breakage of the tooth will be there. Otherwise, this is one of the best treatment to go with. And the biggest advantage with the lithium disilicate laminates is like it is having an anti-stain properties. Normally, if you are brushing regularly, even you are doing brushing once also, then you don't get any stains like natural tooth how you get. This is the best way to go for the smile design.